Hi, I'm Ronnie Rowland. I'm 47 years old, and I've been a personal trainer for 29 years, and I've had 11 back surgeries. Dr. McCord did my last surgery, put in the cages, and it's definitely a new technique that he helped design. I highly recommend. I had my first surgery when I was 21. I hurt my back racing motocross when I was 18, and I had a laminectomy in 1987. Then I had about a surgery every 6 months until then, and then they couldn't get my back to fuse, and that was the biggest problem. Was they would go in and put more bone in, and they were using cadaver bone, and it just wouldn't fuse. I went to the best doctors in the world. I had Mayo Clinic, Texas Back Institute, John Hopkins, Simmons Murphy Clinic. I went to Duke, and I went to Vanderbilt. All the doctors, all the best doctors, and they just said there's nothing can be done. The fusion looked good, that it was scar tissue. And so, at that point, I'm suffering. My leg's giving out. And so what I did was the doctor, Dr. William G. Davis, who had done my last surgery here in Nashville, I saw Dr. McCord on 2020, and I talked to him. I said, I'd like to talk to this doctor. And he said he was in Boston. He said he was going to fly down. He said, I'm having to talk to you. And we got together, and he said, I think I know what's wrong. And what happened was he went in and he did the surgery on me a couple weeks later, and he had 2 surgeries scheduled after me. And what happened was that my back was in such bad shape, they had to cancel the rest of the surgeries for that day. And it took them 12 hours to do the surgery. And that was a year, that was actually 2 years before he helped design the cages. So this was the old school fusion. And that got me to where my leg strength came back, and he got me going again. And that lasted about 19 years. And then about a year, I guess it was about a year and a half ago, my legs started getting weak again. And Dr. McCord went in with the new procedure and put in the cages, and then it's lined me up. I was carrying 75 more pounds of weight on my right foot. I had a chiropractor come in the gym, and he was checking to see how level everybody was. And I took my shoes off. He goes, what are you doing? I said, I want to see how level I am. He goes, well, you can leave your shoes on. I said, no, I got inserts in the shoe. He goes, oh, okay. And I stepped on the scales, and it showed me carrying 75 more pounds of weight on my right leg. And he was freaking out. He said, I've never seen anything like it. He said, what's going on? I said, well, I've had all these surgeries, and my legs were getting weak. So, I knew that I was going to have surgery. So I contacted McCord, and he looked at it, and he said, yeah. He said, this doesn't look good. So, I waited around to him to, perfect the cages, because I wanted to wait, because I knew he had just started them. I thought, I want to wait, because I know that if he's done it, he just started, I want to make sure that they got it perfected before I had surgery, and just hold as long as I could, because I'd already had so many surgeries. But anyway, after the surgery, I'm lined up perfectly now. I don't have to wear an insert. I can stand up straight. I'm almost 2 inches taller. I can sleep through the night. I don't have to take nearly as much pain medication as I used to take. And I'm just in a better mood. I look younger and I feel younger. I'm more focused. And I've been working on a book for Premier Fitness. It's a personal training company. We work out of several gyms. Going to promote this book, and actually Dr. McCord's going to be in the book. I want people to know there is hope, because at one point I didn't think there was hope, because I went to the best doctors. When you go to the top doctors, and these guys are listed as top doctors, and they tell you there's no hope, and they'll tell you the same thing, it gets to the point where you're just like, okay, there's no hope, and then you see all these other people hurting, and and they're like, oh, these doctors, they cut on me, it made me worse, and I'm thinking, gosh, I'm gonna be in a wheelchair. And basically, before Dr. McCord got a hold of me, my legs were getting to the point they had to roll me around a wheelchair to do the test on me. I mean, my right leg was giving out on me so bad, and then my left leg was starting to give out on me, so I was in bad shape. But my strength of my legs is back. I'm working out again. I do everything on machines. I train a lot of people with rehab. I do a lot of back rehabilitation, and I do also shoulder and knee rehabilitation. But I want people to know there is hope. Don't buy into the fact that they can't help you, because it's not true. I'm a living proof. I mean, it's the 11th back surgery I've had. So there's nobody that I know of that's had 11 back surgeries, been able to do a bodybuilding show, and can do what I can. And it's just, if I hadn't met him, I wouldn't be doing it. I would have not been working. I wouldn't have been doing anything. I couldn't sleep. The pain down my legs was so bad I couldn't sleep. It didn't matter what I took. I could take as much Neurontin as I wanted, which is seizure medication. I was taking Elvil for burning pain, narcotics, muscle rest. It didn't matter. I just couldn't sleep because, just had intractable pain running down both legs, all the way down to my toes. But now I can sleep. I'm not having the problem, with the sleep. I can sleep all the way through the night now. It's great. And it's just hard to believe. But when I walked in the gym after the surgery, everybody was like, they couldn't believe it. They were like, is that Ronnie? Because I wasn't limping. And I was like straight up. And they said I looked like 20 years younger. So they were really just surprised. It's going to be about working out, core training. It's going to be about nutrition, and it's going to be about supplementation, like for testosterone, both males and females when they hit menopause and andropause, which is getting to be a big thing now. But it's just overall health in general. And also talks about building up your core. After you have surgery, you need to build up your core, but you've got to do things right. And a lot of people get in their mind, they think weight training is bad for you. Weight training is good for your back if you do it right. If you do it wrong, it's going to be bad for you, but it's just like anything else. But again, you've got to get your back fixed before you can do this. I did all that stuff before I met McCord. It didn't do anything but irritate the problem. I couldn't do it. It would just, if I tried doing anything, for example, I could try doing, say, maybe on a machine, I could bench press 45 pounds, and I had pain going down my leg so bad for like a week. It was just constant. It wouldn't let up. And it was just miserable, and that's hard to believe now, because I can get on it now and do it. I have no pain at all in my leg, so it's just amazing. But these doctors, they did all these tests. They did X-rays, they did CT scans, they did myelograms, they did MRIs, they did the electrical study where they shot me, and they did a discogram, and they found nothing wrong. They said, we don't know what's wrong. And they said, we can't help you. Again, they said it's scar tissue, but it wasn't. What happened was my back actually was not fused. And that's one thing that I like is, he goes in, he takes bone out of the hip. And that way, your body, you don't have any chance, you have less chance of your body rejecting it. And a lot of doctors, they take the shortcuts by using the infused bone or the cadaver bone. And I think that was the big problem I had, or one of the big problems is because my body was rejecting the bone and they didn't realize it. And the pain that I went through in the hip when he took the bone out was the last time was really, I didn't even feel it. It was whatever I don't know what he's doing, but it really worked good as far as taking the bone out of the hip. Now the last surgery I had, I did go through more pain because he had to do so much. But one of the reasons is because the more muscle you have on you, the less the pain medication will do for you, because you have more receptors in your muscles, so it takes more medicine to get you out of pain. Plus your muscles are thicker, so when they cut on, they swell more, so you're going to have more pressure on your nerve roots. But once you do get over that initial hump, you're going to bounce back quicker. So it's very important to work out and start working out. He let me start working out light after about 2 months after surgery, and in 3 months he said I could hit it hard, which, I didn't go real hard, but I started going harder, and just gradually worked up for about 6 months, and then I knew at that point I could, really hit it without, hurting my fusion. And, I just want to let everybody know that there is hope. Don't give up. Just because doctors have said, that you can't be fixed, that's not true. Yeah, if you've had multiple surgeries, you're always going to have some degree of pain. It's just the way it's going to be. But as far as your legs giving out and having that pain where you can't sleep at night and having to take all these high doses of pain medication, you don't have to live that way. I don't know everything that Dr. McCord does. He's so busy, I haven't sat down and discussed it with him, but whatever he does, it works. And he is just, I'm not trying to belittle other doctors, because there's other good doctors out there, there's great doctors out there, but he's just a step above. Whatever he's doing is a step above and beyond. One of the things different about him is he has confidence. He's not afraid, and that's one thing I've noticed. A lot of back doctors are real afraid, they're fearful, and that makes people feel uneasy because it shows lack of confidence. And that's one thing I like, is he's confident. Now, if he doesn't think you're going to need surgery, he's going to say, no, let's hold off, or let's don't do this. And that's the sign of a good doctor as well. But another good sign of a good doctor is he has confidence. He knows what the problem is. He knows how to fix it. He knows what he's got to do. And a lot of doctors are too iffy. They're like, I'm not sure. Maybe we could do this type of surgery. We could put an X block in here, or maybe we could go and do this here. He doesn't do any of that stuff. He just goes in. He's perfected a procedure that he uses for everybody. And that's the thing about it, is he's done it so much, and the more you do something like that, the better you become at it. And he's not all over the place. And I think that's one of the problems with the spine surgeons in general, they all have these different theories, and they're all over the place. And we run into that with personal training. We have all these different training styles, and people get hurt, people don't get results, and it's just like nobody's on the same page. And that's one thing that, any orthopedic doctors out here listening, I hope that they will, listen to what I'm saying and think about things. Think about, get with Dr. McCord, look at what he's doing, because everybody needs to be on the same page. When you're all over the place, not only does it make patients scared, but you're going to have more problems. I know medicine is not an exact science. That's why they call it practice in medicine. But when you've got people all over the place, scattered, doing all these different techniques, you're going to have more complications. If you can find something that works, go back to the simple, basic stuff and do it right. There's where you're going to get your best results, and that's what McCord's done. Dr. McCord has figured out what is the best procedure for most people, and he's perfected it, and he's done it so many times that he knows what to do. He knows what to look for if something goes wrong. He doesn't do stuff that we can't go back in and fix it, and that's a big problem too, is you don't ever want to go in and do something you can't go back in and correct. I mean, I know nothing's absolute in medicine, but he's got it down to an art, to the best you can do, to the best that we've got as far as the technology has today. And, I would just like to encourage people listening to think about that a minute, to think about, do you want to go and do you want to go and have surgery by these doctors that does all this stuff and they're not really sure of themselves and, well, we might help you, we might make you worse, or do you want to go with somebody that knows that, hey, I can help you, if your legs are giving out on you, and he's had all these people, all these testimonies to prove it. And I've had 11 surgeries. I was in such bad shape that when I first started having surgery, my family, friends are like, "Oh yeah, you'll get back into working now. You'll get back into work. You'll be doing this." And then after a while, it's like everybody's like, "Okay, you're not going to be." They gave up hope because they realized they'd seen all the best doctors, and really, they were surprised. After when I went to have a surgery by McCord, they were skeptical. They really didn't expect me to do like I did, and they were like, wow. They were surprised. It really blew them away, and it blew me away. But I knew that there was something bad wrong, and I knew that there was somebody out there that knew, that had the answer, and he did. And so I think that's the big thing is just getting people on the same page. And he is, like I said, he's got a technique down, and it's the best technique for getting people out of pain. It's got to be fused, and people need to know they don't need to be afraid of it. If they know what they're doing, they're going to come out better. Just sitting around in pain is going to cause you to be depressed. Your family's going to suffer. You're going to push people away. You won't even know you're doing it, but you'll push people away because you're hurting so bad you just want to be left alone. You just get to the point where nothing matters. But and the thing about it is that's what he's here for. He's here to give you your life back. He's not going to sit there. He is so busy, and his knowledge about backs is so much. He's not going to be able to sit there and explain to you every detail. He doesn't have that kind of time. He's too busy. But he's got it. He's got the knowledge, and you just got to trust him. And that's what I did. I don't ask him every little detail about everything because I know that it would take him weeks to explain it all to me. I don't even go there because I know better. And it's the same with me with clients. I've got more time to spend with them, so I can explain things as I go. But they find out real quick that I'm working with them 30 minutes, and we're just getting started. I mean, I'm still working with them 6 months later, and I'm still explaining stuff to them they didn't know. And that's the same thing with. And in every case is a little different too, and that's the same thing it is with doctors. Doctors, are real busy, and you've got to find the right doctor, and he is the best doctor out there. I've already been to all of them, so I know. It's just that simple. But I'm doing better. I'm 14 months out of the last surgery that he did on me, and I'm so much better. I can walk so much better around the gym. People are noticing it. They're like, "Wow, you look younger. You look so much better." And just getting a good night's sleep has allowed me to focus more. That's been a big thing, and not take so much pain medicine. And I take very little medicine now compared to what I did. And that pain medicine is I know you guys out there are hurting. I know you've got to take it. I know that I understand all that, but I'm telling you that you don't have to take as much if you get your back fixed right. You really don't, because it takes a while to get these surgeries too. It doesn't happen in 6 months. I'm just now, I mean, it took me a year just to really start really feeling it. And these nerves will take anywhere from like 2 to 3 years to really heal up after surgery. I've still got more healing to go. So I'm really excited to see how I do. But these cages are really good. Whatever he's doing, it's good. And I know that other doctors are doing it now. You know, even where I live in Aiken, South Carolina, I had a lady that I'm training now. She just had them put in her. And, you know, and I showed her a brochure, Dr. McCord. You know, he's the one who helped design it. She looked at it. She's like, wow. She goes, you know, she was really impressed. And you know, and when he first started these cages, I trained an anesthesiologist in Aiken, and he used to work out of the hospitals down here in Nashville. I never told Dr. McCord is. I won't mention his name, but he used to work around Dr. McCord some, and he told me, he said, you know, when Dr. McCord first came to Nashville, he goes, he was thought of as a rebel. And I said, what do you mean? He goes, well, he said other doctors didn't like him, the back doctors. I said, why? He said, he was doing stuff that the rest of them weren't doing. And they thought he was just crazy, you know, doing all this crazy stuff, and he was going to hurt people. And he goes, but, you know, he said, you know, now it's mainstream what he was doing. He said, now they realized that he was just ahead of them. And you know, and it is what it is. I mean, it's called innovation, you know, and he was just ahead of everybody. And I don't know what he's doing now. I haven't asked him, but I know that he's up to date and he's doing what's best for everybody. And that's the good thing about it, is I know that I'm going to get the best. You know, you're going to get the best care with him. He's not going to do anything crazy, outlandish, that he's not going to use it as a guinea pig. It's going to have to be proven, but at the same time, he's going to have to make some common sense. He's not going to do anything that has no common sense. You know, they put some of these discs in there, he was telling me, that will collapse. And, you know, it looks good on paper, but in real life, they collapse. And then if they collapse, they can cut your spinal cord, you're in a wheelchair. He's not going to do anything like that. He's going to do it to where if anything was ever happened, he can go back in and fix you. And, you know, that's what you want too. You don't want a doctor that'll do some crazy new technique on you, and then if it breaks down, you're back, you're crippled. So that's very important. But, you know, Dr. McCord has done so many surgeries. I'm sure he can do this stuff in his sleep. He knows what to do. If he runs into this problem, he knows what to do. And I think one of the things I've noticed is people are bad. And I was like this when I first started out. One of the doctors that messed me up the most was he was the most talkative. He had the funniest sense of humor. He'd make you laugh. He taught and taught. And, you know, as far as his personality, I mean, he was just so much fun to be around. But as far as actually being able to go in there and do the surgery and fix me, he couldn't do it. Every time he went in, he made it worse. And yeah, he'd spend an hour talking to me. But when it came to surgery, he could not fix me. And, you know, it just got worse and worse and worse. And you can't judge a doctor by how much time he spends with you or what he says. Found that out too. Because the good doctors are busy, especially nowadays. They don't have a lot of time to sit and explain everything to you. And, you know, that's another thing, is people want all these explanations. And I understand, you know, being on the other end, I understand that. But I also understand that they don't have time. Doctors don't have time to do that. And so it's so hard. It's like trying to find a needle in a haystack. It's like a maze trying to find a good doctor. And then you'll hear somebody else say, well, this doctor here was good. You know, I went through that too, you know. They're saying, oh, this doctor was good, and then I go there and either like they can't help or they did surgery on me and I got worse. So again, I got very lucky to find McCord, and a lot of other people got lucky too. I haven't talked to anybody that said, yeah, I wish I hadn't have went to Dr. McCord, or that, yeah, this other doctor was better. It's always been, everything that I've heard has always been positive. Yeah, I was lucky. He got me standing upright for the first time. It was always something positive. And so, I mean, that's why I came away from South Carolina to have surgery, and there's a lot of other people are too. And there's no doubt that when it comes to orthopedic spine surgery, he's the best in the world. There's no doubt about it. I mean, there's no question in my mind. You'll never convince me different, because I know where I was, and I know where the best doctors told me where I was going to be, which was living that way. And I was taking all this medicine, you know, and people are, you know, and it gets to the point where you're taking so much medicine and it's not helping. And then everybody's starting to think, oh, this guy's addicted to pain medicine, you know, and then then you really feel bad about yourself. That makes you feel even worse. Because then people around you, you know, they see this vicious cycle. You're hurting, you're taking pain medicine, your body, you know, builds up so much. I don't know how much it adapts to it, but all I know is I have to take very little pain medicine now, and it works. to where earlier I was taking all kinds. It wasn't doing me any good at all, very little. Another thing I want to talk about, and this is, when I was 18 years old, I was a professional motocross racer, and that's what started my back trouble. I wrecked, and I got ran over by another motorcycle, and that was done. I knew I wasn't going to get back on the motorcycle, nor did I want to at that point, because I knew that I could get paralyzed. I was 18, and when you're that age, you're invincible, you think. But when you get hurt, you realize, oh man. And you can't go back and take stuff back. It happened to you. But I had two passions. One was to become a professional motocross racer, and the other one was to become a professional bodybuilder. That was, when you're young, you've always got these passions. And I didn't have the genetics to be a professional bodybuilder. But I have the knowledge. I've trained people, and they've got their pro card. So I've been around it all my life. And the weight, the motorcycles, that being taken away from me didn't bother me so much, because it was getting to the point where I was racing so fast it was getting pretty scary. Because you're really putting your life on the line. But the weight training destroyed me. The fact that I couldn't wait, I was having trouble trying to weight train, and that my friends were training, and I was training people to train, and I'm sitting here watching them get in shape and get bigger, and I was just wanting to do anything, and it was killing me. That really bothered me, for a long time, and and I would try everything. I backed my working out down to even just once a week. I would go in there and just work out once a week, just to stay kind of muscled. But no joke, I would work out once a week, and I'm talking upper body, not doing anything with free weights, just lying down on my back, and I would hurt down in my legs, so bad for sometimes 2 weeks, and a lot of times it'd be 4 or 5 days. It just depended, and it got to be so frustrating. I can remember one of my old workout partner. He bought a new Mustang, and he said, "Ronnie, I want you to come over and drive my new Mustang." And he'd come over and pick me up, and this was before Dr. McCord did surgery on me. I went to push the clutch in on the Mustang. I couldn't push it in. He said, "What's going on?" Because my legs were always a lot bit stronger than his. He said, "There's something bad wrong." And I said, you mean to tell me you could push that clutch in easy on that Mustang?" He said, "Yeah." And I said, "I can't push it in." I said, "I'm not going to be able to drive your car." And it was very frustrating. And he said, "Well, you'll get back into working out, but later on, after I'd had with surgery," he said, you need to give it up. You're never going to be able to do it." And so it was very difficult on me, because working out something I'd been doing since I was about 12. I'd been studying this stuff forever. So I was like Arnold Schwarzenegger, but not Mr. Olympia. I just was just obsessed with it at the point. And it really affected me. And but the fact that when I was able to get back into it, it was just like going back and revisiting my youth and being able to do it again. It was just, you wouldn't believe how much better I felt about myself, and just it was like living again, basically. Because when you want to do something that bad, and it's what my profession is. I'm training people to do this, and I'm training people to work out, but I can't do it. It was so hard on me. It wouldn't have been as hard on me had it not been my profession. If I'd have been doing some other type of job, and not been around it, but to be around it. And then everybody's asking me, "Well, why are you not able to do this?" And it was so hard. But when I got back into working out, people were like, "Wow," they were like, they were surprised. They were like, "Man, your arms are getting huge," stuff like that. They were like, "Wow," they were really surprised. We're working on it right now. Dr. McCord's going to be in it, and there'll be some other doctors in it. And the NPC chairman for bodybuilding in South Carolina, he's going to be in it. But it's going to be really good. It's going to help a lot of people out. And one of the things that another thing is I got back in. I finally got to the point to where I did a bodybuilding show, which I always wanted to do when I was younger, but I was able to get back in the bodybuilding show, and I did a couple of those, and the third one I did, I won the Masters, and that was back in 2011 in August. It was Excalibur in Charleston, South Carolina. And the judges said, "We've never seen anybody that's had that many surgeries do a bodybuilding show, but more or less win the show," and they were really impressed, and which made me feel like I really accomplished something, because I didn't think I'd ever be able to lift weights again, and then I was able to go on a bodybuilding show and win it. So that just goes to show you right there that there is hope.